So this next one is also my presentation. So in this, we have tried to create a low-cost burr. Normally, burr which is used in pterygium surgeries to remove the residual pterygium tissues.
Can you start the presentation, sir?
Yeah, I'll just start.
Yeah,
I'll just speak up. So normally a burr which is used in the pterygium surgeries to remove the residual pterygium tissues, that is very costly. So we have tried to create it in a low-cost manner.
A pterygium is a wing-like growth of degenerative subconjunctival fibrovascular tissue that crosses the limbus and encroaches the cornea, causing ocular irritation, inflammation, and poor cosmesis. Recent times have seen an upsurge in the number of pterygium excisions being performed. With the use of conjunctival autograft and fibrin glue, the recurrence rates have massively dropped. However, remnant pterygium tissue on the cornea can contribute to poor symptomatic relief and dissatisfied patients, not to mention the unacceptable cosmesis. In advanced and strongly adherent pterygium, dissecting it off the cornea can prove to be quite a task, and one may end up with inadequate dissection and remnant tissue over the cornea, resulting in poor cosmetic outcomes and uneven ocular surface, thereby rendering the whole procedure futile. An effective solution for this is the diamond burr, which aids in the removal of densely adherent pterygium tissue and smoothens any surface irregularity. It is an indispensable tool, and inevitably it comes with a price. A commercially available burr can cost anywhere between 68 to 75,000 rupees. We at our institute have designed a much cheaper but equally effective alternative to the commercially available diamond burr. The raw materials required to build this are a 50cc syringe, a switch, a motor, a 9-watt battery, and a burr tip that is used in most commercially available burrs. The 50cc syringe is dismantled and the plunger is separated from the barrel. A window for the on-off switch is cut out in the syringe barrel, and the needle adapter is also cut off. A motor to power the burr is inserted first into the syringe, followed by the 9-watt battery. The switch is now lodged into its opening in the syringe tube, where it fits snugly. This arrangement is held in place by closing the tube with a plunger seal. Finally, the burr tip is attached to the motor by placing it in the position of the needle adapter. The burr is now ready to be used and is turned on and off using the power switch. A steady flow of balanced salt solution is injected while the burr is used on the cornea to dissipate the heat produced. The rotating action of the burr tip loosens the densely adherent tissue of the cornea, thereby facilitating its easy removal and smoothens any surface irregularity caused by the thick pterygium tissue. The post-operative outcome is a smooth, even corneal surface without any residual pterygium tissue. This ensures complete symptomatic relief as well as a desirable cosmetic outcome for the patient post-operatively. The cost of this alternative is under 3,000 Indian rupees, a fraction of the cost of the conventional burr.
Thank you, Dr. Kunal. Thoughts, Dr. Naresh Babu, sir?
How do you sterilize this?
So normally we used ETO also. We have tried, normally in our OTs we have used ETO, and we put in ETO bags and then ETO it right, regular instruments.
And what is the RPM of the motor which is used? Because can it be standardized?
We are designing another design also where we are using a regulator to control the RPM. That is still under development. So this design, it's directly the switch, which gives the power, and the motor rotates at the maximum RPM.
Yeah.
So
you cannot control it.
No,
basically.
It's not. And the other design which we are designing right now, we are trying to fix a rotator, like a regulator of the fan, like that, to regulate the RPMs.
Is there any chance of the Burr coming out of
No,
the
no,
motor?
we are using it regularly. It's not.
No, how it is
It's
fixed
snugly. No, the Burr tips are the same like what we get commercially. Those cost like 1,500 like that. The main cost comes from the main motor. So that only we replaced it.
No, no. What I'm asking is dislodging of the
No,
Burr
it's not.
from here.
It's not. It
because
fits.
this is designed for the other motor.
No, no.
Their commercial motor.
The hole inside the Burr tips snugly fits in the motor head.
Oh.
And what would the lifetime of this be, sir? How many?
Sorry?
What would the lifetime of this be? How many cases can you use this for?
We are
Or-
using it regularly since 1 year, 1.5 years. It doesn't give any
And
issues.
you charge the patients extra, sir, for this?
No, no,
Nothing. Okay.
nothing.
Thank you.
Thank
sir.
you.
So the next talk will be by Dr. Shivraj. He'll be talking on the incremental innovations in eye care. And I would request Dr. Vignesh to be ready with the next talk. I would request Dr. Kunal to collect his certificates, please. Dr. Naresh Babu,
This
sir.
is big. You have opened Vignesh, Dr. Vignesh's. No, I am Dr. Shivraj. You have opened Dr. Vignesh's PowerPoint. Yeah, this is me.